Hello, my name is Stephanie Kang, and this is my research proposal presentation for the MSGH 410 Research Methods course. The title of my presentation is The Evaluation of Knowledge and Prevalence of Hypertension and Related Lifestyle Choices in Orangé, Haiti. Orangé, Haiti is located in Léogâne, which was the epicenter of the 2010 earthquake indicated on the image to the left. To begin, I would like to review some background information on hypertension and how it relates to Haiti. Hypertension is a major global health issue. The International Society of Hypertension in 2001 indicated that hypertension is responsible for almost 8 million deaths worldwide, if not causal for 54% of stroke, 47% of ischemic heart disease, 75% of hypertensive heart and renal failure, and 25% of other cardiovascular diseases. This same report indicated that low and middle income countries shoulder 80% of the burden for hypertension attributable disease. According to the American Heart Association, there are many risk factors related to hypertension, including health conditions, lifestyle choices, and family history. It also indicated that Blacks develop high blood pressure more often than Caucasians and have been shown to develop high blood pressure earlier in life. Haiti is the poorest country in the Western Hemisphere and is shown to have a 20% mortality rate due to hypertension and hypertension-related diseases. In June 2012, the Haiti Ministry of Health published in the journal Le Noveliste a report that stated for Haiti, hypertension is the greatest cause of morbidity and mortality among adults, ahead of HIV, cholera, tuberculosis, and malaria. Orangé is a remote community in the mountains of Léogâne. It has no access to clean water or electricity. The population size is about 10,000 people, mostly subsistence farmers, and those who live on less than $1 a day. Community Health Council has been delivering medical care through mobile clinics since 2014 to the community of Orangé. During these clinics, we have seen high indicators for prevalence of hypertension. Overall, there's limited data on patient information in Haiti, but records from outpatient rural clinics indicate a prevalence of 39% in men and 45% of women with a hypertension diagnosis. A published data set from a Port-au-Prince clinic even suggested a prevalence of 69% in men and 67% in women older than 40 years. The behavioral risk factors for hypertension include high salt consumption, lack of exercise, and smoking habits. In Haiti, the average daily intake of salt is 9 times more than the WHO recommended amount. However, physical activity is also recommended for hypertension prevention and treatment, yet Haitians have been reported to walk upwards of 10 kilometers a day. Since the context of hypertension prevalence and causes may not be the same for Haitians, it is important to gain greater understanding of the prevalence of hypertension and the relevant behaviors associated with hypertension specific to Orangé in order to provide effective treatment and educational interventions in the future. Our objectives for the study include providing an estimate of the incidence of hypertension in an adult population in Haiti, and also creating the first descriptive summary of the adult population dynamics that are related to hypertension in Orange, Haiti. Such information will be essential to evaluate the impact of preventive measures and the potential role of changes in major risk factors such as diet, exercise, and smoking, as well as to target public health objectives in the future for Orange. Our central hypothesis is that there will be a significant prevalence of hypertension in adults from Orange, Haiti, and a low level of knowledge of hypertension and behavioral risk factors. More specifically, the prevalence of hypertension in Orange will be similar to the prevalence rate in Haiti overall due to lack of access to care and resources. Patients with hypertension will report significantly low understanding of hypertension and behavioral risk factors for hypertension due to lack of educational resources. The questions we'd like to answer include: what is the prevalence of hypertension for adults in Orange? And what is the level of knowledge for hypertension and its related behavioral risk factors for adults with hypertension in Orange? Secondly, is there a socio-demographic or behavioral characteristic that is more significantly associated with hypertension than others? The design for this proposal is a cross-sectional study to determine the prevalence of hypertension and hypertension-related behaviors and the knowledge level for these aspects in Orange, Haiti. Orange, as mentioned before, is a remote rural community, and due to the lack of resources, this could serve as limitations for the study. The study population will be patients 18 years or older with hypertension and not pregnant, and the patients will receive at least 2 confirmed readings of a greater than or equal to 140 millimeter mercury or diastolic blood pressure of greater than or equal to 90 millimeter mercury and a clinician diagnostic confirmation of hypertension. The primary exposure being studied is if a patient has hypertension or not. And the study will also assess if patients report participating in hypertension-related behaviors and if he or she understands that the risk factor of these behaviors in relation to hypertension. The primary outcome to be measured is the prevalence rate and knowledge level of hypertension and the related risk factor behaviors for hypertension in Orange. These will be measured by manual blood pressure readings and a self-report survey on hypertension knowledge, sociodemographic, and behavioral characteristics related to hypertension. The survey will not be using a Likert scale, will instead be including multiple choice and open response. So the survey can be and will be analyzed both quantitatively and qualitatively. As mentioned before, Community Health Council has been setting up mobile clinics in Orange since 2014. So at the next mobile clinic, the proposal would suggest that at the normal clinic setup, at the triage, after the vitals and demographic information is obtained, patients with normal blood pressure, they'll be removed from the studies, but patients who do have an indicated high blood pressure of greater than or equal to 140/90 will have that indicated on their medical record, and then continuing down the patient flow to see a clinician. Once they see the clinician, their medical history will be obtained, a medical form filled out, receive a diagnosis of hypertension, and then get a prescription for medication for hypertension. After this point, the patient will then be sent to a private area to participate in a survey. Before the survey is administered, an additional blood pressure recording will be performed, and consent procedures will occur by someone who speaks fluent Creole. After the patient answers all the questions from the survey, the community health workers will give patients education on hypertension and clarifying any misconceptions the patient had mentioned during their responses in the survey. So this is what the survey would look like. It has an arrangement of multiple choice, yes, no, and open-ended questions. And as you can see, there are just various questions to really gauge, first off, does hypertension mean anything to the patient? Do they feel like that this is a serious or not serious impact on their health? Do they feel like they are capable of doing anything to lower their blood pressure? Or do they feel like it can only be taken care of by a doctor? Um, how often they get their blood pressure checked? How do they react to certain symptoms? And so forth. And also talking about exercising, what is their diet, smoking. So it really tries to address the different behavioral and lifestyle choices that can impact their health. I know that the font is pretty small on this slide, so I have also attached it to this presentation. So if you are interested in looking at it in a PDF, feel free to download it, please. Thank you so much for listening to my presentation. I know the design of my study is pretty basic, but I think that it's a necessary step since there's such limited data on hypertension and the related risk behaviors in Haiti. And I think it's a necessary first step before creating uh, educational interventions for the community of Orangé that will be able to effectively impact the specific context of in which hypertension exists in Orangé, Haiti. Thank you.